And with that, Rachel, we're happy to take any question that's on anyone's mind.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. Happy Friday. A couple of questions about what tweaks might be made to the executive order. You indicated earlier in the week that there would be some changes in this version. If I understand you correctly, the consultation about elective procedures, that's coming up on the next revision. What's going to be different about this one from what we've seen? And specifically, at whatever point we get to reopening restaurants and bars for sit-down service, the White House guidance.
We'll get there.
Well, I had a specific question about that, not when's it going to happen.
Okay.
The guidance from the White House suggested that bars should stay closed longer than restaurants, that even when restaurants reopen, the bars may not. What's the rationale for that distinction? Is that a distinction you would expect to make at the state level?
Feel free to chime in here, but I've got the recommendations from the White House. We did, as I mentioned yesterday, I joined that call with the President, the Vice President, his whole entire task force team. I was 30 minutes tardy, but I was here. I had a good excuse. They knew that. And they have supplied us with their guidance. And as you mentioned, Eric, it is that. It is guidance, and it is reasoned and sound and thoughtful. A lot of work has gone into their national recommendations on how to approach this. Obviously, they contemplated that different regions of the country were in different phases or stages of this pandemic. And they also contemplate, most importantly, that what we don't want to do, one of the worst things that could happen is if we get this resurgence. So you have to prevent putting yourself into a position where there is a resurgence of COVID-19. You talk about the hit that would take to the American psyche. And so we're going to be very responsible, very methodical. I mentioned that we're going to work with our Indiana Hospital Association to make sure that we're in touch at the street level with the supply levels of PPE that may be in high demand. While we may talk to one region of the state, I'm pointing towards southwestern Indiana right now, that is in solid shape. There are other parts of the state where if they heard me say, we're good, we don't need any more PPE, they would say, Eric, I would get a call very soon. And they would remind me about the need. And that's why I said at the very outset that we need folks who are firing up those 3D printers and helping us make face shields, the Department of Corrections who's helping us make gowns, the sewing groups that are all over the state of Indiana, Berry Plastics down in Evansville. And I could just go on and on and on about all the contributions that folks are making. So to answer your question, Eric, that's what this time between today, the 17th of April, and May 1, it's exactly what we're reviewing all of the ideas across the state of Indiana that would lead to some changes. I just alluded to a couple of them. One is that we're shortening the time frame because we know of the progress that we're making in some areas and some things that we can do, but we'll take this approach in an ongoing fashion.
So the only thing I'd add to that, Eric, is I think there's a little bit of difference with a restaurant that can separate their tables and have individuals sit down as a family a lot of times or very close-knit friends versus a bar, which I don't spend a lot of time in them anymore, but I can remember a lot of, person-to-person, very close contact and a lot of enjoyment going on, but not necessarily a lot of social distancing. So I think that may be a part of what the concern is.
Steve, KPC Media.
Afternoon, Steve.
Good afternoon, Governor. I wanted to start off by thanking Dr. Box for the great statistics that we got today. Very happy to see those. But today my question will be for Commissioner Payne, if he's around there with you.
He's making his way up. Steve, you can take a little credit for that information that's incorporated into the slideshow. And thanks for your patience.
I needle Dr. Box with a lot of questions, but
they're very helpful.
I'm going in a different direction today. So I wanted to ask, today we got the state's employment report for March, which reported a March unemployment rate of 3.2%. And please don't take this the wrong way, but I laughed at that, knowing that that was not a complete number. And it looked like that was only through March 12th, really, before we got into the bulk of the COVID impact here. So I wanted to just ask, is that typical? Do we have numbers that look at a full month? Do we have an idea of what the true March unemployment rate is? And when we get our more detailed county level report on Monday, should we expect a full month, or should we just expect this snapshot view again?
Those are good questions, Steve, and thanks for asking. The monthly employment report is a coordinated effort throughout the nation. All of the states and our federal government, we have a specific time frame in which we report numbers. That time frame covers the week that includes the 12th day of the month. So you're really looking from midway from month to month. So for March, that week actually ended right before we started seeing a surge in our unemployment claims. So if you look at the week ending March 14th, if you recall, we may have had about 2,500 claims filed that week. But then the following week was when we saw the huge surge. So that number only captures the week before. It doesn't fully capture what's actually happened the second half of the month. And if you look around the nation, you will see that the unemployment rate only jumped slightly for some states. Some jumped a little bit more than Indiana because they started seeing unemployment claims filed probably a week before, like Ohio, some instances, I think, Kentucky, and to some small degree, Illinois. So what we'll see in the next month's report will be more reflective of what's happening now, because it will cover the second part of March and actually the first few weeks in April. And that's also one of the reasons why on Thursday we report our unemployment claims numbers on a week-to-week basis, because that's actually more reflective of what's happening now.
Fred, you mind, your staff, Herculean effort, pulled an all-nighter, obviously, to get positioned for today. And I threw out a figure there, and it was $200 million that kind of probably just zoomed right by some folks. You want to talk about, come Monday, you want to talk about all the work that's going on, how fast you've turned and burned to get this, from the federal help that we received out the door into people's bank accounts.
Sure. Yes, Governor. So the Governor is referring really to the pandemic unemployment compensation and the additional benefits that we've really worked right around the clock to make sure that we're delivering. If you recall, we received guidance sometime late March on how to apply and how to implement those programs, and we quickly turned around within about a 2-week time period actually updates to our system to make sure that we were providing those payments for the additional $600 a week under the pandemic unemployment compensation. So last night, we had anticipated the uplink system to be offline for about 3 hours. It was actually offline for probably about an hour and a half. So we were a little bit ahead of schedule on that. And so payments started dropping today. We had some to start drop today, but then we have in the queue payments to start dropping on Monday, somewhere to the tune of about $200 million in payments of those $600 increments. Keep in mind, those payments are retroactive. That encompasses people who've already filed claims from March 28th or the week ending April 4th.
Thanks to your team for operating at the speed of the need.
Corey Williams, The Associated Press.
Yep. Good afternoon, Corey.
Good afternoon, Governor. Can you hear me?
I can.
All right, I have a quick one for you. I'm calling from Michigan. We're doing a double team state thing on you guys here. If you guys are able, and some of the other states are able to do a rollout, are you envisioning weeks or months? Some people are thinking that maybe they'll be back to work in early June, but conceivably, could it take into the deep summer before everyone, if they're able to get back to work, gets back to work?
Well, that remains to be seen by the numbers as they come in. And do our mitigation efforts continue to work? Are we continuing to make progress? Where is that progress occurring? That's why I was tried to be clear about the fact that we're going to continue to work with our our neighbors to make sure they know what we're doing so that our action, we understand, could have a reaction or an equal or greater reaction from someone across the border. We want our neighbors to know what we're doing, but we're not going to say this will. We don't know. We don't. Anybody that tells you some date specific, 2 week or 1 month or 2 months, and how that plays out into all the different sectors of your economy, whether it's schools or state government or the private sector or the philanthropic community. This is all going, the way we do business will be different. What we know will be a prerequisite is that it will have to be done safely and when it's safe to do business. And so we'll continue to work with the Governor Whitmer, and we'll continue to work with Governor Pritzker, we'll continue to work with Governor Beshear and Governor DeWine, and further out from that so that they know how our region, all the pieces that snap together of this puzzle are functioning and the progress that we're making. And we'll continue to, if we see, someone else have a good idea, we'll look to implement it here as well. We won't dither. Care to add anything about the regional approach?
Ditto.
Yeah, ditto.
Jeff Smith, WLFI.
Hello, Jeff. Good afternoon.
Good afternoon, Governor. Dr. Box, I think this is probably more for you, and I hope it's a no news is good news situation. But in all the discussion about long-term care facilities, and in fact, I think since we've been discussing COVID with you, there has never been any mention of the Indiana Veterans Home here in Tippecanoe County. Can you give us a snapshot of what that looks like in terms of patients and staff members?
Off the top of my head, I don't have that. Again, we're only going to give aggregate data, but I do know that we went in there early on. I think we tested some individuals and really worked with them to make sure that they had the PPE they needed to protect all their residents there, and talked about their infection control procedures. And so, yes, it's not come on my radar, so I think that is a no news is good news.
Dan Klein, Wish TV.
Good afternoon, Dan.
Good afternoon, Governor. I hate to be the negative Nancy, but I think a lot of people are worried in the aspect of, I think we can go through this once, but 4 months from now, 6 months from now, when obviously no one can see the future, but when there are more cases maybe coming together, when it's schools back in session in the fall, do you think this is going to be a reoccurring thing, or what types of things can be done to keep this from being more than just a one-time thing?
Well, there's a lot of good news. And I understand the anxiety or folks being nervous. This is a pandemic, by definition, a global occurrence that came washing upon our shores in a very swift manner. And fortunately, we were nimble enough and collected and organized to where we came together equally fast. And a lot of credit goes to our first-line responders, whether it's EMS or police or the hospital system at large across our whole state of Indiana, to be able to accommodate that first rush and that surge. Everything that we've been doing is designed to try to mitigate that surge. And to date, I'm not celebrating, but we've kind of flattened that curve. We've kind of drawn it out so we can, as a state, handle COVID-19. Having said that, with every death that is reported, with you just heard from Dr. Romuletti, who really knocked him down for weeks on end, and his wife, when this hits, it hits hard and drains a lot of resources. Our goal in this all has been able to get in it and then get out of it responsibly, safely, as fast as we can, and be able to handle anything that could wash back up on shore. It's, the good news is, and please add where I'm deficient here, but our health, our local health offices, in conjunction with your partnership, obviously in the state and our hospital system, we're going to be in a much better place after this ordeal than we were before it. We just maybe didn't know what we didn't know.
I think the point is that if we do see another wave of this in the fall, and again, remember, this is the novel coronavirus. We don't know exactly what it's going to do. We can't predict it. Certainly, there's a thought process that we could see a wave of this again in the fall, and we're not expecting the vaccine to even become available till the fourth quarter here. So we won't have a lot of people that are immunized, but what we will have is better testing capabilities. We can test people, we can isolate and quarantine people, and we can make sure that we are able to stay on top of that. We'll have the PPE that we need to be able to provide for our frontline EMS and other individuals. Our hospitals will have time to kind of recuperate and get back on their feet and have more of their personal protective equipment. So if it comes, we'll be ready for it, and at that point in time, we'll have to see what's happening and keep track through contact tracing of the number of cases that we have and increased testing, and so we'll know what we need to do at that time.
Matt with WFIU.
Hello, Matt.
Good afternoon, Governor. My first question is for you, and the second one is for Dr. Box. Do you plan to, or are you considering to designate grocery store workers as first responders? And Dr. Box, some counties are reporting testing anyone with symptoms and others have very limited testing. Is the Department of Health planning to make any statewide testing protocol for who gets tested and when?
We have not to date. We have prioritized them as essential workers, and so there are some benefits to that in terms of child care and how we treat them as essential workers. And you want to take the second part of his question?
Sure. So to date, there's no specific plan about testing in every single county, but I can tell you that we have been doing drive-throughs. We'll be doing more drive-throughs. We shortly will be receiving the cassettes for our Abbott testing, so we'll be able to place those in some of our more rural areas so that we can have that quicker turnaround time. I did just receive, or will be receiving, I got notice, 100,000 swabs. So like that's the best Christmas present that I've had in many, many years. So I think from that standpoint, it's really looking up. What I want everyone to know now is if you are seeing somebody who is symptomatic and you suspect they have COVID-19, test them. It's fine. Test them. You can send to LabCorp. You can send to Quest. You can send to me if you're concerned that we need a quicker turnaround time and we can get it done through Lilly, through IU Health, or some of our other local labs. So it's wide open. If individuals are symptomatic and the healthcare personnel thinks that that individual has COVID-19, please test.
Lindsay Doty, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I know we don't know when this will be, but when this happens, which type of workers do you think will be among that first wave of those who can go back to work? Are you thinking it's people who work in traditional offices or manufacturing employees or some other sector?
Well, I'm not trying to hide the ball, Lindsay, honestly, but that's exactly what we're doing, going through every sector. That's why we sent out about a letter to about 17 different associations, because we didn't want to act like we had all the answers right now. If they were seeing something, if they wanted to share how they would be able to safely conduct business, I don't want to discount, obviously, the folks who are running their businesses. They know how to act safely. So you'll have to wait until Monday, and then until May 1st as we start to very methodically pull more and more folks back online.
Cassie with Whitewater Publications.
Hello, Cassie.
Hello, can you hear me?
Crystal clear.
All right, great. So I have two questions as well. My first one is for you, Governor.
Okay.
I'm curious about, you were talking a little bit about reaching out to individual sectors and gathering their plans of what they think they could do to kind of in their own area or own business get their economy going again. As far as tourism, I know for our end of the county that is a big thing where we try to bring people in, and right now we're kind of trying to hold them out. When you think about those guidelines moving forward, do you see that as like a specific kind of manual guideline that you would hand out to tourisms around the state that says, you know, these are kind of the things that we think are safe that we could start doing or allowing people back into our community? Or do you think it'll be left more up to each county and each sector to kind of make those decisions with approval?
little bit of both. I mean, we want their input. We're sincere about that. And coming from a state like Indiana, where tourism, the Lieutenant Governor heads this and heads this sector and this industry effort up. Understanding how important our tourism and our convention business is. Understanding the size and scope of events that we host here in the state of Indiana, we're equally concerned that we are able to do that safely. It may look differently. It may look different in different sports and leagues themselves. They're already starting to weigh in. So if you're talking about racing, how is IndyCar different than NASCAR? If you're talking about basketball, if you're talking about horse racing, if you're talking about, it's an endless list. And so we will obviously provide some guidance because of the density of the crowds that come. And then also you have to layer on top of that the timeline. Where are we always? What are the numbers? What is the science telling us that it would be okay to move forward on? And so it's not a one-size-fits-all, one-place-fits-all approach as we move forward, whether it's in tourism or in any other sector in our state. Agriculture, manufacturing, key sectors of our state, and size of the business. Some, just as an example, some businesses are telling us that they are prepared now, when they come back online, to provide masks for their employees or to take their temperature of their employees twice a day. These are just some examples of that kind of close interaction business that will occur. So how do we do that? That's why not the who, but the how and the when are just so important in making these decisions.
Nikki Kelly, Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. I was wondering, there was a lot of discussion yesterday in the White House recommendations about seeing 14 days worth of drops in cases, that kind of thing. We've seen large spikes in the last couple of days. So why are we talking so much about reopening when cases go up?
Spot on.
So a part of that, Nikki, is because we're testing more people, and that's the hard part to really look at. What we have to look at, too, is number of people admitted to the hospital, number of EMS runs that we have for people that have these type of flu-like or respiratory symptoms, our ventilator usage. There's a lot of other key factors, deaths even, that we can look at to gauge where we are in this. But you're right. As we want to increase testing, and we do increase testing, we will find more positive cases, and that's certainly something that it seems contrary.
And where are those cases? Also important.
Russ McQuaid, Fox 59.
Good afternoon, Russ.
And good afternoon, Governor. And following up on the testing question for Dr. Box regarding the White House Task Force guidelines for tracing and testing, when do you estimate Indiana will be able to respond to those White House Task Force guidelines, for instance, testing and tracing for those with the symptoms of the virus, for those with flu-like symptoms, and also just simply screening and testing in the at-risk communities for folks who are asymptomatic?
So all of that, in some way, shape, or form, is going on right now. We are already testing asymptomatic individuals in our most at-risk populations. So oftentimes in our prisons, in our long-term care facilities, and our residential facilities, and in other congregate living facilities. Testing asymptomatic individuals that are just walking around the street, we haven't done a lot of that testing yet. Testing symptomatic individuals is wide open right now. I hope everybody's doing that. I think that's totally appropriate. As far as contact tracing, we are, along with our local health departments, which are absolutely critical in this, they're really the boots on the ground, and they are tracing these contacts of these individuals and telling them to quarantine if they've been exposed, telling them to isolate if they're positive. That ability to have that rapid turnaround test, maybe even that quick test or that 2 to 3 day test. So you're sick, you go home, you've got to be home anyway because you're sick, but in 2 days or 3 days we have back whether that was COVID-19, is getting there in almost all of our regions across the state. But we really need to work, especially in some of our rural areas, to help with that.
Jody Kaufman, WRBI.
Hello, Jody.
Good afternoon, Governor. Thank you for taking my question. I have two again. My first question is, as you extend the restrictions on Monday, is there a chance you'll be allowing county governments to override travel statuses back to red if they deem it necessary? The second question is, we're a rural area, and in June is when we start fair seasons in some area. Should our local fair boards be looking at creative plans on how to handle 4-H fairs this year, because large crowds will still be restricted starting in June and possibly through July?
Well, it's never too early to start planning ahead, just like planting a crop. I mean, what we do now is going to matter in 2 weeks and 2 months. And so having those plans in place, whether it's, scenario A, B, and C, best case scenario, maybe the more realistic or worst case scenario, I'd have those plans in place right now, pulling in everyone in your local community and getting their input right now. That's going to help us make decisions as well. We've put a heavy emphasis on working with locals throughout this whole ordeal, and so we do value that input. And if something happens, Brown County was experiencing a lot of traffic being funneled into their beautiful park, and we heard from them and said, okay, this is not what we intended. We did not want our campgrounds backed up and packed. That was counter to the whole premise of this exercise. And so we made adjustments. And so we'll continue to do that, and we'll continue going up to May 1st and thereafter.
Lauren Chapman, Indiana Public Broadcasting.
Hello, Lauren.
Good afternoon. I have two questions. The first one for Commissioner Payne, and the second one for you, Governor.
Okay.
The one for you while Commissioner Payne gets up. With the success of social distancing measures and the anticipation of a surge in the rest of the state in early May, is it really in the interest of public health to even slowly start to reopen businesses, since those numbers seem to kind of coincide with one another?
You want to actually take the numbers?
So remember, the models are just that. They're models, and they predict a surge. When we look at our day by day and our hospitalizations and our ICU beds being more open and our ventilators being more open, we're really looking at curves that in many parts of our state are starting to plateau or flatten, and we may even be seeing some go down, which is very optimistic. So that is the kind of things that make us feel like we can start to think along these lines. Once again, we still have a lot of individuals in prisons and in long-term care facilities that are ill, and they will, we know, a certain percentage, maybe 20% or so, to 25, which you saw on the slides today, end up in the hospital. So we can't take that lightly. And I think one thing we haven't said with all of this is that as we open things up and do more things, it may be about the individuals that are at higher risk until we can get to that immunization, to that vaccine. As much as I hate to say it, that we may need to continue to protect them and continue to have them avoid these large crowds and these settings where we know they're most likely to become ill.
I went to you because you look like you had something on your mind, and you obviously did. And I would just add very quickly, and we'll get to Fred. It is responsible. I mentioned at the outset that we were in a planning phase. This is a planning phase, and what we don't want to do is end up on the 22nd or May 1st or any date thereafter and wish we would have done a lot of work to position ourselves to loosen up in an area that is safe. But we're not flying blind here. We are reporting the data on a daily basis, and this is what will guide us. Fred?
The question I had for Commissioner Payne was, is there a target date for adding the additional 13 weeks of unemployment benefits under the PUEC provisions of the CARE Act?
It's a good question. We actually just received the guidance on last week on that, and the team is working on it, but we have not established a set date for when we'll roll that out.
Our final question is from Lauren with WTHR.
Hello, Lauren.
Hi, Governor. My question is probably for you, Dr. Box, or you as well, Governor. Well, we've had some expansion of testing this week what will it take to get to this needed level of testing? Will this mean more federal help or time from other sources or more supplies, or will labs have to be upgraded?
No, I think that our major labs like Quest and MACL, LabCorp, all of these labs are up and running. We still rely for that rapid turnaround time with Lilly and IU Health and some of our more homegrown or local labs. But it's really about getting people back in to see their healthcare providers, back into their federally qualified health clinics, their community health clinics, being seen for these type of symptoms and being tested. And I think that's really where we are right now, is we need to start testing more individuals out there, and that will be through our healthcare systems.
Thank you for joining today's briefing. A media advisory will be sent with details regarding the next briefing.